Hello there, and you're here with Nyah Williams. I use she, her, hers as my pronouns, and I am here today with Maeva from Common Square Health Center. And over the next few weeks, we're going to be discussing what Common Square is and what services they're providing. Today, we're talking about trans care at Common Health Center.
Hi, Nyah. It is a pleasure to be here. My name is Maeva Veillard. I use she, her pronouns, and I am the lead clinical navigator at the X Clinic here at Codman Square Health Center.
Nice. I have a few questions about the trans care that's provided at Common Health Center. So I'd like to start with first, as someone who lives a trans experience, how can I expect to be treated at Common Square Health Center?
Yeah, so first and foremost, you would definitely expect to be heard, seen, and affirmed here. We tailor our behavioral risk assessment to the people that we are serving. So we know for a fact that not every person is cisgender. We know for a fact that not every person has penetrative sex with a penis and a vagina. And so in our behavioral risk assessment, we actually ask our patients like who they're having sex with, and we don't just say like male or female. We say trans folks, gender non-conforming folks, because we know for a fact that sex is vast and a person's identity is also vast. And it's really important that if we're saying that we want to take care of a person, that we are taking care of the whole person, and that includes trans folks.
Thank you. And that's so amazing. I like that you guys offer these services and to make sure that everything is gender inclusive.
Yeah.
And it's very important because not a lot of clinics offer that.
Yeah, I actually learned about that, in my first couple months here. I actually had a patient who was like, I have never been asked the questions that you guys ask us here, which really showed to me that we are really doing our best to make sure that we are providing the best care, and we're really taking into account the full identity of the people that we're serving.
Exactly, and that's what's really important, because it's bringing people together and it's showing a diversity within the system, and which is really important because everyone needs that to see that, because it's not just about cisgender folks anymore, it's about trans people as well. And we need to recognize that as a community, that trans people like myself need to be understood and understand that our health comes first as well.
Right.
Push to the side anymore.
Right. I'm fully on board. Studies show that a lot of trans folks actually, they are more likely to delay seeking care because like there is like fear, right? And so at the heart of what we want to do here is to make sure that that is not a thing that our patients here feel, that if they feel that anything is wrong, or if they feel like they need anything, that they're not waiting to get care, that they just come because they will be seen and heard.
Thank you for that. Moving forward, will staff at Common Square respect my pronouns?
Yes. So we actually, in the X Clinic, we actually have pins that have our pronouns, and that is because we want our patients to know that we are fully aware of the fact that a person's pronouns are very important. And actually in our behavioral risk assessment, we ask a person, first of all, like how they like choose to identify, because we know that, the sex that you were assigned at birth does not necessarily line up with your gender expression. And so that's something that we definitely take into account, and we ask our patients how they identify, and we respect their pronouns 100%.
Nice, thank you. So, how can I feel reassured that Common Square has my health and their best interest?
So you can be reassured in the fact that we have so many staff members who are set in place to really take care of our patients, right? So when you come into the clinic, you're not only seeing me potentially, but you're also seeing a nurse practitioner. If you say at any point in your visit that you would like help with housing or help with food, we have a community health worker who is like here to help a person with that. And that's because we believe that a person's health is not just, you know, like you coming into our clinic, but it's also like who you are and the life that you are living, right? So it's not just seeing me, but we also have a community health worker here. If you were to say that you feel like you would benefit from behavioral health, we could actually do a behavioral health referral also. So we really, really take into account the health of our patients.
Thank you. And that's definitely really needed.
Mm-hmm.
Okay, I'm going to close out. Okay, that's all for this week's episode. Tune in next week where we talk about mental health services provided at Common Square Health Center.